Hello everybody, welcome to the Locator Locum webinar, how to recruit more bank staff in your care home. This is about the 10th in our webinar series. We've been doing these for about half a year, and it's always great to see so many new faces and new attendees. And what we usually start with is the housekeeping. So I'll just explain, if you haven't used this platform before, what to do. So we have a little questions box on the right. If you have any questions throughout the webinar, pop your questions in there, and we will either stop and answer them if they're pertinent to what we're talking about, or we will do a Q&A at the end. There's also a chat box. So again, it's really cool whenever you come onto the webinar just to pop your name in the chat box and we can say hello. So I can see there's Deborah's in, Susan's in. It's great to have so many people in, especially on such a nice evening. Well, especially here on such a nice evening. It's great to have attendees. So yeah, thank you all for attending. I'll just introduce ourselves firstly before we get started. So I'm Stevie McIntyre. I'm the marketing lead here at Locator Locum, and I'm joined by Jeanette Hare, who's the healthcare lead at Locator Locum.
Hi everyone.
Yeah, so it's fantastic that everyone could join us, and we will maybe give it like 30 seconds before we crack on. Just there's a couple of people I can see still joining, which is great. And again, we appreciate you giving up your time this evening. It's always fantastic, especially in the healthcare industry. You work so hard during the day, and it's very, very. We feel grateful that you give up your evening to join us on these webinars. Okay, I can see there's more people join now, so we'll just get started. So the webinar title is How to Recruit More Bank Staff in Your Care Home. And who are we? We are Locator Locum. And to give you a bit of background about who we are, our mission is to mobilize the world's healthcare workforce. And how do we do that? We do it by getting the right person in the right place at the right time. And what you can see on your screen now is our product suite. So the product suite is made up of 5 products in the care home space. It's made up of the Rota and Leave product. So the Rota and Leave product is kind of as it says on the tin. Rota is creating and editing rotas, and Leave is tracking leave requests. So what that allows you to do is approve and decline leave requests as a manager, and as an employee it gives you the ability to have live access to the Rota through a mobile app and have live access to requesting leave no matter where you are. And obviously if you've got a Rota, there'll be gaps in it, and those gaps will need to be filled by either agency workers or your direct bank pool, and that's where our bank product comes in. So this allows you to send shifts directly from the Rota out to your pool of direct bank staff, which we're going to talk about later. And these are instant notifications, and bank staff can then accept them, and they'll be popped straight into the Rota. And there's more functionality that's associated with that. Now, our next one is expense management, and this allows you to add and approve expenses and payments. So obviously if you've got bank workers working, you'll need to pay them, and this is how you do it. You can track everything through there, and it's linked to payroll as well. We also have a time and attendance product. This is checking in and checking out of your care home or care homes, and it gives you visibility and control of staff working patterns. And then last but not least, we have the reports package. So this allows you to have 100% data-driven decisions in your care home. And you can access key insights such as locum spend, or sorry, say locum, that's the pharmacy industry, staff spend, where the gap reports, things like that. So it's really, really, really intuitive. So that's sort of a whistle-stop tour of our product suite. And if you have any questions about that, you can pop them into the questions box, or if you have any specific requirements or you want to see anything in more detail, again, just reach out via questions box or post webinar. You can get in contact whenever we send the emails out. So what are we going to cover tonight? Firstly, we've done the introductions and housekeeping, so that's great, that's one ticked off. Firstly, we're going to talk about market conditions. So we're going to look at where are we now, why are we doing this webinar? Then we're going to look at growth and techniques to grow your bank staff, and then we're going to look at engagement and communication. So you might have a bank pool, but how do you engage with them and how do you communicate with them? And then we're going to look at some reporting elements like reducing agency spend and improving compliance. And then, like I said, we'll stop with a Q&A, finish with a Q&A. So what we always do in these webinars is we start with a poll. So what this allows us to do is to get a gauge of who's on the webinar. and what they would like to see and what they want to get from the webinar. So I'll just launch the poll, and that should pop up on your screen. So you should be able to see the poll now. And I'll just give 30 seconds for everyone to complete the poll. It's really great, these polls. These sometimes dictate how we proceed with the webinar. What they also allow us to do is follow up with you on anything you might be particularly interested in that maybe we didn't cover. So this poll is, what do you want to get from the webinar? Do you want to learn how to grow your bank pool? Do you want to learn how to reduce agency spend? Or do you want to learn how to improve communication with your bank? So I can see most people have completed that. So I'll just close the poll off, and yeah, that's okay. You should be able to see my screen again. So yeah, I can see from here that most people want to grow their bank pool, which is great because that's the title of the webinar, and that's what we advertise it as. So that's kind of what we expected. There's a couple of people here who want to improve communication, so hopefully we'll cover that too today. So that's fantastic. We can go on the webinar, and we know you're in the right place. So it always fills us with confidence. So where are we in the care home market? What are the market conditions? I'm sure most of you guys who are on this webinar and who are watching the live recording would agree that the staff morale, staff are feeling stressed and rushed, and maybe this is leading to burnout. We've gone through the whole COVID phase, the vaccination phase, and now we're getting into sort of a little bit of normality. And maybe staff are now starting to feel it with, you know, that they've been through all the new regulations, and there's a lot more to do in terms of admin, and a lot more to keep track of in terms of social distancing and things. So that's inevitably going to lead to burnout, low morale, and the need to replenish stocks of staff, and maybe like fill shifts so staff can take holidays. There's also high levels of sickness. I mean, this is inevitable. If people have coughs and things, they need to get tested, and they can't be in the care home. So there's high level of sickness. What this is doing is then putting pressure on the care home managers and owners to fill shifts, but it's also putting more pressure on the staff who are remaining to fill shifts. So that's why it's so important to fill your bank pool. And again, like we've seen across all healthcare industry, all healthcare disciplines, that there's an increased demand for temporary workers, and that's across all sort of disciplines outside of nursing, and also within the care home in terms of healthcare assistants, care home managers, and staff nurses. So huge demand. So hopefully tonight I can take you guys through some methodologies that you can put in place almost immediately to try and recruit more bank staff. And likewise, you could probably employ a few of them to recruit more permanent staff. But we're gonna continue. This is a quote. We did a care home manager survey, and this quote came out from one of the bits of feedback. So staffing issues take up a huge proportion of my working week, and not least of all trying to boost morale and keep care staff grounded during a very challenging times. That's obviously a nod to the COVID times, but it gives a little bit of a feeling and a reinforcement that staffing is very much at the forefront of everyone's minds in care. And here's some other points that back it up. So we had about 200 people complete this survey, and mostly care home managers. So what is your biggest challenge as a care home manager? And 49%, nearly half of the people who we surveyed said staffing was their biggest challenge, which again highlights why we're doing this sort of thing. And then what is your top priorities as care home managers? It's a slightly different wording of that question. So we wanted to know, obviously we thought patient care will be the main priority, because that's what you're in this line of work for, to care for patients. But secondly was staffing. Again, it's a massive priority. It's maybe something that isn't being actioned or dealt with. So we are here tonight to try and help. And again, this feeds in, the staffing feeds into the answers to this question. How would you rate stress levels in the last 3 months? 72% of people said high. So theory would tell you, if you can solve a bit of the staffing problems, you can reduce stress, and everyone's life is better with a little less stress. So let's see if any of these techniques can help you guys. So attracting bank staff. So this is what we're going to cover. To give you a bit of context and a bit of background on myself, I work in marketing, Locator Locum. We get people to sign up for events like this, which we've had so many sign up for. We also look after the temporary workforce for pharmacy industry. So we have to actively recruit temporary pharmacists for that marketplace product of ours. So one of the primary rules of my job is to recruit those people and get them even in hard to fill places. And often there's a shortage in places, and I'm trying to find the right person to go with the shift. So these techniques sort of come from my knowledge of doing that and things that really work. So I'm going to share with you a few nuggets of information that hopefully will guide you down the route to do whenever you're recruiting temporary bank workers. So I'm going to cover understanding bank staff and what they want. I'm going to talk about referrals, which is something maybe you guys haven't considered. I'm going to talk about advertising as well, which is maybe a little bit of an obvious one, but I'm going to try and give you guys some tips on how to effectively advertise and improve conversions. So first of all, how do you attract bank staff? Well, the simple answer is this: you can't unless you know who you want to attract. So what I've been suggesting to people is the way to understand your bank staff is to survey the ones you currently have, or survey all your staff. This will allow you to advertise to the correct audiences. It'll allow you to know your care home's unique selling points, like what's great about your care home. Is it that's an amazing location? Is it that the staff are amazing to work with? Do you have a small unit that it's really focused on a certain discipline? Could be anything. We've seen lots of things come out of these surveys, and it's sometimes surprising for the care home or the pharmacy owner whenever they get the results. They think we didn't think of that. It also allows you to improve. So you might get something that you could action almost straight away to improve, and it also helps you dictate rates or fees or shift payments for temporary staff. So what that is, you'd ask almost in the survey, what would be the ideal band for you to work at, and you could put some different banding options, and this would allow you then to dictate the rates you put out to agency staff or you give to your direct locums. So I would say, yeah, this is really key. This is something that I've been suggesting to a lot of care homes recently. If you don't know your audience, you can't effectively advertise. So that's number one. Number two is the power of referrals. So did you know that a referred customer or employee has a 37% higher retention rate? So what that means is if you can get one of your staff members referring someone who to join your bank or to join as a permanent member of staff, they're almost 4 times more likely to stay in the workplace, which means that you don't have to repeat this process further down the line. It allows you then to be back focusing on care and not recruitment. And then an employee referrals are 4 times more likely to work, which is again reinforcing the first point. So that is basically saying that if the employee refers a person, they're 4 times more likely to actually work through your organization. So that's a really key one. You think of how many people apply, and this takes all that whole process away, and you sort of get a first-hand referral, and you know yourself that it works whenever someone refers a product to you. You're more likely to try it because you have trust in them automatically. The other great thing is referrals have no cost per acquisition, and this is like a very marketing-y term. Cost per acquisition, or CPA, is what you pay to get back on your return. So if someone refers someone, you're not paying a recruitment fee, you're not paying an advertising fee, and you're getting someone to work for you who you know a little bit about through the referrer, and you don't have to pay for it. So it's a win-win for everyone. Although one thing that really works is incentivizing referrals, because this will yield better results. So if you incentivize an employee and say, oh, we're actually doing a £50 bonus, for example, if you refer someone to the bank staff, well, you then know that it costs £50 to get someone in your bank pool by paying this bonus. But the good thing about that is it's a win for the staff member because they get the money in their pocket, and it's a win for you because you get someone who you can trust in your bank pool. And like I said before, they're 37% higher retention rate, so they're likely to stay working for you. So I would really suggest referrals. Great marketing technique, great recruitment technique, and something that you should put into place almost immediately. So the great thing is the Locator Locum platform, it manages referrals. So this gives you an idea of how we manage it as a platform. So on every direct worker's profile, there's a little button that says refer a friend. It brings up this screen. It allows them to share a unique link through all their social networks and communication apps directly to their friends. And what that allows them to do is then sign up through your bank page, which I'm going to show you, or your landing page, which I'm going to show you, and then it's trackable. So there's really not a lot of legwork in trying to keep track of all the referrals you get. I say all the referrals. Hopefully, there's a lot of referrals. So that's just how it looks. So better advertising. So understanding your target audience is key to better conversions. And like as I said before, the survey is almost a step before you start advertising. Understand who the people are and what they want and what people are like about your company, and then use this to dictate the content and messaging of your advertising. So even if it's an offline ad, like a newspaper ad or a flyer or something like that to get recruit people, you should use the content that you get in your survey. And that way it's more real, and also it's based on almost like a mini focus group. And then advertising social media. This is a really obvious one and probably something a lot of care homes do. So you can advertise through Facebook and Instagram, but what I would say is skip those two and go straight to LinkedIn. For a start, LinkedIn has a better cost per acquisition in terms of advertising. So what this means is you spend less to get more people through. And also LinkedIn is just a CV online. You get so much more information about the person who you want to recruit. You get their job history, their where they're based. You get almost little references as part of their LinkedIn profile. So whenever someone clicks through from LinkedIn, it's trackable right back to their profile, and it will save you time in terms of getting CVs and things. So really highly recommend using LinkedIn. Another thing I always ask people is, where does your target audience hang out online, or where do they go to consume? It's a marketing term. So have a think about that as well. So you might have an amazing ad. You could have the best ad, but done by the best designer ever online. And if it's in the wrong place, then you're not going to get many conversions. You're not going to get many people signing up to your Locum pool or your bank pool. Sorry, I keep saying Locum. Signing up to your bank pool, just because it's not in the right place. So have a think about where these people consume their information. Perhaps there's a nursing industry publication that you could target, and perhaps there's a certain journal article that the care staff read, or there's Facebook groups or LinkedIn groups. So have a think about that. And then last but not least, on better advertising is wherever you're directing these people to sign up to your bank pool or relief pool, make sure it's really clear and it's optimized and it has a real clear call to action. All too often you would see ads and you click through on them and you're interested, and then there's a page with a lot of noise. So never direct someone just to your home page, because there's so much going on they couldn't click through, and you want to make the process as frictionless as possible. So what I always suggest is send them to a landing page with almost like 4 fields that they need to fill in order to join your bank pool. Make it as easy as possible to join that bank pool, because once they're in, you can then communicate with them and engage with them. So what we do as Locator Locum is, whenever you join our workforce management platform, any care home gets a unique landing page branded completely to your care home. So this is an example of that landing page. And as you can see here, we have the ability to put in a big headline about what's amazing about working through you, and also the benefits there and the ticks. We also have links to your shifts that are live currently, so someone can go see what's actually live and needing filled before they sign up. And then we also have all the fields necessary to let them join your bank pool. And the best thing about this is that once they're in, our platform allows you to communicate with them through different methods. So that's kind of me. So I'm going to hand over to Jen here, who's going to take you guys through engagement and communication once these people are signed up, and hopefully you found that useful, and I'm happy to take any questions at the end.
Thank you, Stevie. Hi, everyone. So yes, Stevie tonight has taken you through how to grow your bank in a very competitive market, shall we say. And what I want to take you through is how you can communicate with the bank staff using our technology to do so, making it as efficient and as easy as possible. So with the Locator Locum app, all staff members have an app that they can download onto their phone. And the benefits and beauty of this is that they, should I say, have push notifications through of any shifts that are available. So our home managers will actually just post out the gaps and they'll receive an automatic notification of that shift. So how does that differ from what you currently do? And this is something that I hear time and time again. How do you communicate? And most home managers, I would say probably about 90%, will either use telephone, which turns into the whole telephone ping pong scenario, increasing stress from the home manager, obviously to get that shift filled, leaving messages and taking time away from what they are meant to be actually doing, which is caring obviously for the residents. Or you've got the whole WhatsApp group thing, which in theory is brilliant, okay? But the downside of it is that I'm not sure about you guys, but I know that I have group chats that go on in WhatsApp and I tend to mute some of them because they're constantly going off. So what happens is sometimes I actually miss really important things that are going on or information that I need because I've had to mute it. So it means that if your staff bank or your standard employees are chatting about social things and other aspects of maybe working life, they can potentially miss any gaps that you need filled. So our app obviously enables them to get that information. It's there and they can see it clearly. Okay. Stevie mentioned as well, obviously, we facilitate you growing your bank using our landing page, but our solution is actually a lot more than that. It also ensures that you have 100% compliance because what it can do is each staff member has their own profile, and on that profile, you can attach all the necessary documentation that they need. So their insurances, training, and so forth, okay? And what you're able to do is actually put expiry dates on that. So what that enables you as a home manager or homeowner is to ensure that you can see what is expiring before it happens. And our solution will actually notify the home manager and the staff member to let you know that their documentation is expiring and you can get that sorted so that you're not in a position where you need a gap filled. You've got a staff member that can actually do it, but they don't have the necessary training or they shouldn't be there. But also with that, even from something that I've heard quite a lot recently is when you're prepping for, say, CQC inspections and you're having to collate all the information and make sure you have it there, or the home manager's having to do that. Again, that's time consuming, it's admin heavy. All that information is stored in one place. When the inspectors come in and they ask that information, you're able to log on and show them. You're not going to a filing cabinet trying to hunt it all out. It's all there, it's in your face. You can see expiry dates and everything. It's, you know, and you're not going to lose anything either, which can happen obviously if you've got a paper process at the minute. So what happens is, as a home manager, if you can talk through a scenario, somebody phones in sick this morning, for instance, and they can't make this evening shift. So the standard process would be pick up the phone and you start calling around all your staff members, your relief, and also your current staff that maybe aren't working to try and get that filled. Okay, it's time consuming, as I mentioned, it's inefficient, and you don't know if you're actually going to get it filled. Okay, with Locator Locum, you can log on, look at your bank staff and those that are of your employees as well, and see who's available. You can send out a push notification, which is one click of a button, to send out those shift details to all your employees that aren't working and also your bank staff, so that they all get the notification. And what they're able to do then is they'll receive it on their app and they can then accept or apply for the shift or accept it depending on how you want to work it, really, okay? If they apply for it, the home manager gets this information here, okay? So in this case, we've got 2 bank staff, for instance, who are wanting to work that shift. You'll see there, you can see exactly where they're located. So are they close enough to the home that you want? You can rate them as well. So if they've worked for you before, you can say if they've been on time, or they're reliable, and so forth. Okay. So all that information is there. And then it's up to the home manager, in this case, to book that particular applicant. So what happens is all they have to do is click book, and that will then notify the bank staff member that they've been booked for a shift. Again, they get a push notification through, just like you would in Facebook or Instagram or all the other social media platforms. So they'll get it clearly, they'll be clearly notified that they're booked for the shift. They also have the ability to view their shift. So if you ever have the scenario where, especially with multiple care homes, you have staff members who are willing to actually fill the gap for you, and they turn up at the wrong location, there's no oversight of that. Or they thought they were maybe starting at 7 and they were due in at 6 and so forth. All that information is there for them. So they're able to actually ensure that they're there for the shift, and that you're not having to fill that with either you as a home manager having to stay on till they arrive, or to get some other staff member to do that for you. And then one thing that I always like to note is that, as I mentioned at the start, this is a really competitive market. I'm sure you're aware. And if you have bank staff, those bank staff will more than likely also work in maybe other local care homes, or be registered for those other local care homes to work shifts as well. So what you want to do is you want to make it as easy as possible for them to get shifts with you, and to make it as easy as possible to get payment as well. Because obviously they're going to go to the home that they know exactly when they're working, and they have full oversight, and when they're going to get paid, and they're going to get paid on time, and they're going to get paid correctly. And again, if, say for instance, you have a bank staff member who maybe only works in a home 1 or 2 days a month, or maybe 1 or 2 days a quarter, just when you need them, and they tend to sometimes fall off payroll, because the home manager is doing a million other things, okay, and they're trying to manually collate the hours of their current staff for payroll. So you know, a part-time or somebody who's maybe only working every couple of months may fall off, and that means they're not paid on time. That makes them disgruntled, and what that means is they will probably go to the home that pays them on time. Okay, so to ensure that you reduce that, the bank staff member can log on to their app, and they can actually send the invoice of their shift to the home manager automatically. Okay, so it's really clear, they know exactly what they're being paid per hour. The home manager obviously gets full access to that and the hours of work, and they'll know by their timesheets if they come in and left during those time frames and things as well. And what they're able to do is they can either include that, obviously, for payroll. It's there, it's, you know, they don't have to remember it with all the other millions of things they have to do. And so they have full access to that, or they can automatically pay them. So some homes are now issuing 24-hour turnaround in pay, to ensure that they keep their bank staff and keep them happy. And so what you don't want to do is obviously get all these bank staff members and then start losing them due to things like this. So they, as I mentioned, the home manager has access to the expenses, and they can literally, if you go to the next slide, Stevie, they're able to actually trigger payment as and when they need to. Okay, so again, it's quick, it's easy, that bank staff member gets paid. So yes, that's just a really quick overview of how that works. And one of the things, obviously with our app and our platform, is that you can also report on this information. Okay, so for instance, this is just one of our reports, but what it lets you do is it lets you see what is your agency spend versus your bank staff spend, for instance. Okay, and you obviously want to have your bank staff in there rather than agency, which is obviously a lot more expensive. But it also lets you forecast, so you're going to know, okay, this, say for instance, July, it's holiday season, people all want it off, and you tend to have to go out to agency, or it's January, everybody's got a cold or whatever, and there's a higher sick rate. You're able to plan for that and try and maybe even like for next year, you know, right, at the minute I have 10 bank staff or relief staff, I want to try and grow that to 20. So I'm going to start with my, promoting my landing page, as Stevie's mentioned, and encouraging those signups as efficiently as possible. There's various reports on the system that you can collect, so users, hours of work and things like that. But this is just one just to kind of highlight what you can capture, which if you're using a manual process at the minute, I guarantee you cannot just collate this information in 5-10 minutes. This is something you have to manually sit down and work out. And then with any manual process, you usually will have an error rate. So having it all automated for you, it's a click of a button, it's seconds rather than minutes, and it's there for you. And obviously promote or to go to head office with for forecasting really. So we've had a number of care homes who've obviously signed up to the Locator Locum app. And this is one of our clients, Julie Beacom, who's a care home manager. And they were very much a paper-based home, which is standard. If you are paper-based, you're not alone. But what she found is that by introducing the Locator Locum app, she was able to increase her bank pool by a massive 400%. And with the help of Stevie, was able to continue that growth on from the initial recruitment drive. They had a reduction of agency spend, which I think, and I probably need to check this, but I think it was something like 40 to 50% agency spend reduction, which is brilliant, especially during the pandemic, obviously when the staff were staffing levels were at an all-time low. As I mentioned as well, zero payment or errors. So when you automate any system, the system calculates the information for you. We're all human, and we could be calculating hours of work, for instance, and the phone rings or a patient is sick, or resident, should I say, is sick, and you need to then obviously treat the resident as opposed to calculating hours of work. So things can happen and errors occur. This takes that away from me. And then obviously, as I mentioned at the start, you're guaranteed 100% compliance. All your necessary documentation is captured, it's stored. We look after it. There's no loss. You don't lose contracts or insurances or anything like that. It's all in the system, and you're also able to keep up to date when they're expiring, so that you are ensuring all your staff are compliant. So that's really all I wanted to take you through tonight. I hope you found it informative. If there's anything you want to obviously ask, feel free. The floor is going to be open now. But if you want a more in-depth or a more personalised demonstration of the product, please feel free to get in touch, and I would be happy to have a chat with you, understand how you're currently working, and take you through the platform in a live format. Thanks, Stevie.
Brilliant, thanks, Jen. Yeah, so usually I'll just go through some of the closing stuff while we wait for some questions to come in. If you want to ask a question, there's a little question box on the right-hand side. Just pop it in there, and I will read it out, and either myself or Jen will answer. The recording of this webinar will be in your inboxes tomorrow. This is the 2nd of July by lunchtime. So there's also a free ebook, which is a guide to growing your bank, and it just goes through in a little bit more detail some of those marketing techniques that I talked about, and also it also looks a little bit at the platform features, and it gives you a little bit more idea of what they do. And like Jen says, if you need any more follow-up, then you know where we are. You can reply to that email, or you can just get us at info@locatorlocum.com and someone will pick it up. Yep, there's a couple of questions. One from Lorraine, which says, my staff aren't very technical, unsure how they would cope with an app. Is there any way to overcome this? Jen, do you want to answer that one?
Yeah, this is something that people do raise and show concerns on. First of all, our app is UX developed. So what that means is that it is designed to be user friendly. It's available in an app store. So again, we have to meet certain requirements to ensure that it is user friendly. But it's designed in a way that it's very basic, but it allows them to get the information that they need as quickly and easily as possible. If your staff use, for instance, social media, or they can book flights and things like that, then they will be able to use Locator Locum app, no problem. If, for instance, their home manager is a bit more technical, then obviously there's different ranges of what accessibility you have with the app. But from a staffing point of view, it's enough for them to be able to get full oversight and to be able to easily to download it from the App Store. I hope that's answered your question.
Excellent. Yeah, if it hasn't, then you guys can just pop in and we can clarify anything that we haven't covered. So a couple more have come in. We find it difficult to find staff in our area. Is there any tips for this? I suppose I'll answer that one. So
Yes.
I would say the methods I talked about before. So understanding why there's very few staff in your area. Ask your current employees, do they know any staff? Like people who usually are in the nursing care profession, know other carers or have trained with them. I would ask them, do they know anyone local? And like I say, if it's an area specific thing that there's a shortage, you could almost do some targeted advertising to people in and around your town or city, and see if there's anyone willing to travel. But I mean, if you employ some of those techniques I talked about previously, you should have some success, and you know where I am if you want to ask any further questions on that. If that's, hopefully that's a good answer. Do you see another one's come through there while I've been talking? It says, do you charge every time we add someone, or sorry, book someone from our direct pool? As in, did Locator Locum charge? Jen, do you want to take that one?
No, absolutely not. We provide you with an app to make things as easy as possible. Our aim as Locator Locum is to reduce your agency spend. So we're not going to reduce your agency spend and increase that by your booking spend. The app is there to utilise, and no is the answer, in short.
Okay, thank you very much for that question, Claire. Okay, any more questions? That's those three. If there's no more, we can close off there, and then you can get us offline or in the next couple of days. We will follow up with email, like I said. So don't worry about if you weren't taking notes. You can watch this back at your own leisure, and I'm sure many of you will. Share it with other people, other care homes, and hopefully overall you find what we've been talking about useful. We know it's a particular challenge in the industry, and I think our care home surveys really highlighted that. So let's hope we can improve things for you through this webinar. So there's no more questions in, so I suppose I'll just close off there and wish everyone a lovely evening. And Jen, do you want to say a couple of closing remarks?
Yes, thanks so much for taking time out of your evening, guys. I really appreciate it. And as Stevie said, I hope you guys found it informative. If there's anything that you want to hear more about, do get in touch. I'll probably follow up with you anyway, just from the webinar and get your feedback. So it's good to get your feedback as well, even for future ones. So thank you.
Okay, thanks very much, guys. Good evening. Bye.
Bye.